Okay. So today we have the pleasure to welcome Matthew Burbank. So Matthew will talk during this 45 minutes about targeting DART, understanding biological mechanism with NAMs, new approach methodologies. So Matthew is currently at L'Oréal. He's a toxicologist and scientific officer within research and innovation at L'Oréal. He has a PharmD and a PhD in toxicology. He's expert in human toxicology, risk assessment, and evaluation of healthcare products. At L'Oréal, Matthew is a key contributor to the systemic toxicity team, focusing on the development and application of NAMs. And his work is really concerning read-across strategies and developmental and reproductive toxicity assessment, reflecting his commitment to animal-free testing and mechanism of safety assessment. Before being at L'Oréal, Matthew served as a non-clinical assessor in oncology at the French National Agency for Medicine and Health Products, we call ANSM in France, and he was highly involved in assessing non-clinical data for marketing authorization and clinical trials. And he's also, before and during, did a lot of research, and he's published in toxicological sciences, drug metabolism and disposition, with recent contribution on advancing NAMs for teratogenicity assessment and use of in vitro pharmacology profiling for systemic toxicity. And Matthew, to finally, is also actively involved in the scientific community. He serves as the Deputy Secretary General of the French Society of Toxicology. He's also an officer of the EUROTOX Early Career Toxicologist, a very active officer, and a member of the EUROTOX ERT subcommittee, the registration subcommittee. So thank you very much, Matthew, for being there to give your presentation. So you have, as you know, 45 minutes, and after we have 15 minutes of questions. So for the people attending, please write your question in the chat, and after I will read the question in the chat to Matthew. Okay, so please put your question in the chat, and please shut down your microphone when Matthew is speaking. Thank you very much. The floor is yours, Matthew.
Thank you very much, Mark, for this introduction and for giving me this very nice opportunity. So, as Mark just said, I'm a scientific officer in systemic toxicology in DART at L'Oréal, and one of my mission is really to understand and to develop NAMs to be able to use them for safety evaluation of chemicals and cosmetics. So today, how can we predict proteins other tools? So here's what I'd like to propose as a presentation outline. First, we'll see a bit of scientific and regulatory context. Then we will go a bit deeper into the different DevTox NAMs. We will have a few words about AOPs, cases, and biomarkers. Then we will see the big part of the presentation, which is the NAMs coverage across DART biological stages. And we will finish by saying a few words about building confidence in the use of NAMs. And an example to finish is the integrated testing strategy developed by L'Oréal a few years ago and published now. So, fun fact to start with. Have you ever heard about the embryo serum? It's kind of a French sexy name. It was developed by the Orlan company in 1930, and it's known for its fantastic properties, as you can see here, because it's got like very nice stimulating and proliferating properties. It can induce elasticity, reduce wrinkles. It's kind of perfect. But historically, some cosmetic products use embryo extract, chicken extract, for their generative and anti-aging properties. It was used in small quantity or sometimes in combination with some weird stuff also. So from the 16th, we saw a trend to move more towards plant-based. So, ladies and gentlemen, the objective is not to come home tonight and spread a fertilized egg on your face, but rather to show you a kind of a century-old revolution where we are moving from chicken embryo extracts and cosmetics to animal-free assessment. So let's start with a little bit of context. Here you can see the distribution of congenital malformation cause. Approximately 20% difference. So it's the part challenging and first of all, critical period timing is key. This is the most
Do we have issues with your Wi-Fi, or I am the only one who have issues? So Marie-Christine, it's okay. The other is okay. No problem with the hearing, Matthew? Okay, so sorry, maybe it's me.
That's good.
Where's it going? Go on.
Okay, so critical period of exposure. This is the most crucial particularity. Because the teratogen only exerts its deleterious effects if it's present during specific, sensitive phases of embryonic and fetal development, and particularly during organogenesis. The second one is the dose-response relationship, because the teratogen has a threshold dose below which no teratogenic effect is observed. So above this threshold, the severity and incidence of malformations generally increase with dose. There are also like some kind of species and strain specificity, because you all know that teratogenic effects are not universal. A substance can be a potent teratogen in one species. Let's take the thalidomide example in human and rabbits, but have little to no effect in another, like a rodent also for thalidomide, for example. It also has a lot of different mechanisms of action, various cellular and molecular mechanisms. And also, to be teratogenic, the substance must be able to reach the embryo fetus in sufficient quantity and during this critical period. And this is where the placenta has a complex role. It can be a barrier, but also a state of metabolism. So a deep understanding of DART mechanisms is kind of paramount, for human safety. This slide shows you the human prenatal development, distinguishing between embryonic and also fetal periods, and it highlights the sensitivity to the different teratogens. So the process begins with the zygote implantation and blastocyst stages in the first 2 weeks, and it's a period typically less susceptible to teratogens. The critical phase of organogenesis occurs during the embryonic period, spanning from week 3 approximately to week 8. So this time witnesses the development of major organs and body structures. So as development transition into the fetal period from week 9 until full term, the sensitivity to teratogen generally decreased. So you can see this 3 different periods with the prenatal death, major morphological abnormalities, and also functional deaths. And the question is, how can we measure this effect at a human level? And for that, we have some kind of epidemiological studies where we have pharmacovigilances in pregnancy registries, but also case reports and unfortunately also natural experiments and disasters that we all know. And we can also see this kind of effect in studies on occupational exposures. Historically, DART assessment relied on in vivo animal studies and with comparative guidelines that from organizations like the OECD and the ICH. So this slide maps the timeline of embryonic development. Here the example is in rat, showing how different segments of development were targeted by various reproductive and developmental toxicity studies. So, as you might know, there are 3 different segments. The first one is about fertility and embryonic development study. The other one is on embryonic fetal development study. And the third one is pre- and postnatal study. So for these different in vivo studies, we have a lot of different guidelines, mainly OECD test guideline, but also the ICH, ACH, S5 guideline. And this is where NAMs come into play, okay? We are moving towards a paradigm where hazard assessment can be achieved through a combination of in vitro tests or co-models or in silico predictions, organ-on-chips and system models, trying to minimize or to replace the animal testing. But we have a lot of questions here. For example, do the current NAMs allow us to cover all these different periods? Do we have enough in vitro tools? And when I say enough, what's behind enough? What does it mean, enough in vitro tools? Other question that we have is the prediction levels of phage embryos, for example, and the silico tools, are they robust enough? So all of these are different questions we can have regarding the use of NAMs for DevTalks. The good news is, we can have one good news, is that the ACH ACE5 guideline and also the SCCS note of guidance for cosmetics, they reflect a little bit this shift, providing frameworks for the use of NAMs and next generation risk assessment strategies to ensure human safety and regulatory compliance. We will see that at the end of the presentation. So here we got the regulatory framework applicable to cosmetics. I won't go into detail, but it's pretty difficult because it clearly distinguishes between the assessment of cosmetic ingredients and also chemical substances. So you've got the chemical cosmetic regulatory framework, which is a risk-based assessment. And for that, you all know that the animal testing ban was in place for cosmetic ingredients since 2013. Then you also have the chemical regulation with the ECA, which is more horizontal-based and with the objective to have a maximum protection on human and environment. And for that, there's a phase-in on NAMs on the table for chemicals. And I'm pretty sure that you have seen this year that we had a few workshops from the ECA to phase in on NAMs or phase out the animal testing. The last one is the classification and labeling, which is a hazard classification, where the objective is to set our harmonized classification of substance of concern. And for this classification, a few names are used. It's more for local tolerance and mutagenicity. So this is a major challenge for the cosmetic industry and all the chemical results. So we are in 2025. You know the journey for the past advancements in methods, including in vitro, omics, and also high throughput approaches. So this progress is driven by both, I would say, ethical.
Matthew, it's better to shut down your camera because there is issues with the...
Yeah. I'm gonna give me 1 minute. It's better here?
Shut down your camera.
Can you hear me now?
Better, I think.
My camera is on? I think it's off now.
No, it's on. It's on.
Give me 1 second.
Your camera is on the bottom left. If you want to put it down.
Now.
Yes, this is shut down. Now you need to put it back full screen.
Okay.
It's not full screen yet. You have to go on the left parameter. Yes, perfect. Thank you. I'm sorry because your sound was really bad. Thank you.
Okay, sorry. So I was talking about the transformative journey. So we've seen that there is a progress which is driven by ethical imperatives, leveraging the free Rs and also all the scientific advancements. The big question remains, and this question is, how do we achieve a broader regulatory acceptance and guidance for these powerful new tools? Is the sound better now?
It is sometimes, so keep on.
Okay. So let's take a closer look at DevTalk NAMs and their classification to evaluate the DART potential. So on this slide, you can see different test systems used for in vitro assays, and also the categorization of endpoint measure according to whether they can capture events at the molecular, at the cellular, or the organism level. as you can see here, these NAMs can offer broad coverage of relevant endpoint for safety assessment, ranging all from molecular to sometimes whole organism level. For example, the C. elegans, the zebrafish embryos, or the frog embryos. What is very interesting here is to see that various test systems like the 2D and 3D cell culture or even fish and frog embryos can allow for analyzing diverse endpoints like the receptor binding, the hormone production, the cell viability, or the organism morphology. So here we have highlighted some validated DevTalk NAMs by the EGVAM a few decades ago. I won't go into detail into this slide because it's a bit complex, but one interesting fact is that no validated alternative method is yet available for a ReproTox that covers all the different phases, okay? All the different phases of the reproductive cycle. So since the field of ReproTox is very complex, it was expected that, in fact, the various phases could not be mimicked using one and only one alternative method, and that a battery of tests would be needed. So at the time, 3 alternative methods restricted more to the embryotoxicity area have been developed. The first one was the micromass assay using rat cells. Then the embryo stem cell, EST, primarily with mouse embryonic stem cells. And finally, the whole embryo culture using rat embryos. So each has its strength and specificity and sensitivity and targets different endpoints. For example, the EST, is good for cardiac toxicity, while the micromass is more, it looks at more the chondrocyte differentiation. Now we can see on this timeline the remarkable evolution of DART NAMs from the 1960s to 2025. So it started approximately in the 60s with the whole embryo culture, the zebrafish test, and estrogenic and androgenic receptor binding, which were the first DevTalk NAMs. At the same time, you can see that we had the first guideline from the FDA on the 2-species developmental tox assessments. Then 3 other tests, the FETAX using the Xenopus, the frog, the MEST, and the micromass culture, with also at the same time the first ICH S5 guideline. Then the EGVAM, which is the US Interagency Committee that evaluates and endorses NAMs to reduce, refine, or replace animal testing for regulatory purpose, started to work. And at the same time, we had the EGVAM. And all these new NAMs, approximately 25 years ago, all these new NAMs were more based on stem cell and artificial intelligence. What's pretty interesting here is to see that we have progressed from early embryo culture methods to more, I would say, sophisticated systems like virtual embryos and gastroloids. So it's pretty interesting to see all this history in this timeline. Now we're going to see more in detail some of the major DevTalk NAMs. And the first one is about endocrine disruption, which is a key mechanism of concern in DART. Just in general, when endocrine disruptor interfere with the precise hormonal signaling required for normal development, they can cause teratogenesis. This is the link between ED and teratogenesis. One important class of endocrine disruption involves in the interaction with the estrogen and the androgen receptors. And these ER and RR binding tests, such as this one, are crucial NAMs. They measure the constant, the binding of a substance to the receptor, and they can indicate the potential to interfere with the endocrine function or, again, to alter the steroid production. So, while validated by the OECD and the US EPA, these assays have limitations, of course, and we will see the different limitations. They don't really distinguish between agonist and antagonist and are not functional assays. And they sometimes also lack some biotransformation competency. Another interesting NAM is the in vitro pharmacology profiling receptor binding assay. So, and it can offer, I would say, a broader view of potential interactions. And this is a panel that was published 1 year ago from the cosmetic industry. It's for a systemic toxicology panel, can help to understand the mode of action by identifying different compounds that can bind to various enzymes, ion channels, nuclear receptors. So it's pretty interesting, but we also have some kind of limitation with this in vitro pharmacology profiling. They often lack biotransformation competency. Okay, and also just want to say that we are working on a project here with the ICCS, the International Consortium on Cosmetic Safety, and the project is to find out what kind of cellular targets are relevant for teratogenicity, for DART toxicity. It's like a pharmacologic signature, something that we could use to understand a bit more the mechanism of action. Transcriptomics, it's also a very powerful approach for the identification of mechanism of action and also different pathways. And the objective is to analyze the changes in gene expression in different cell lines and try to quantify also gene pathways that could be involved in reprotox. So the method is kind of relevant for human-derived cell lines. But there's some kind of challenges with the validation. You all know that validation and data interpretation also of transcriptomic is pretty tricky. Also, the protocol standardization, making a DART signature something we're still developing. This one is the steroidogenesis assay, which is a validated NAM for assessing the endocrine disruption, and it measures changes in the steroid hormone production. So it is based on the OECD test guideline, and it assesses the human relevant effects by evaluating how the different chemicals can interfere with enzyme activities in the steroidogenesis pathway. So it's a relatively low throughput method, and the metabolic capability of these cells is unknown. So it's pretty difficult also to capture all the metabolic fate of all the chemicals or the interactions with other hormones. So moving now to stem cell assays. The report tracker assay from Toxis, which is very popular. I'm pretty sure you heard about it. It utilizes human-induced pluripotent stem cells and can offer a human-relevant model to assess the developmental toxicity. So this test is pretty interesting. It can measure biomarkers for early and late stage differentiation into the different layers, endoderm, mesoderm, and ectoderm, and it can provide also a morphological and a functional profiling of liver, heart, and neuronal cells. So while it's internally validated for ICH AS5 chemicals, its initial focus was more hazard-based, and pretty interesting to see now that future application of this test involves the integration of PBPK model through current differentiation, which is limited to cardiomyocyte, hepatocyte, and neural roses. Another popular assay is the DEFTOX Quick Predict assay from Stemina. This one is not a iPSC based NAM, and it provides an indirect assessment of developmental tox. So how does it work? It measures the cytotoxicity, but also the metabolome biomarker changes, and specifically the changes in two different amino acids biomarkers correlated with teratogens, ornithine and cysteine. So this offers general non-specific endpoint, okay, but applicable to human iPS cells, and where we can see the alteration of the endogenous metabolism. So again, it's internally validated and it's undergoing FDA qualification. So this is pretty interesting when you look at the validation status. But its limitations include, again, not providing information on the precise mechanism of action and a very low specificity when plasma Cmax concentration is not incorporated into the output value. And moving into more complex models, the 3D embryo-like gas fluid systems offer a powerful tool for the DevTox assessments. So it's very interesting because this stem cell-based model, they mimic early embryonic development, and we can with that study marker gene expression and also all the different morphological changes. So a mouse gastroid-based assay has been validated. So it was based on mouse, and human gastroid models are at a proof of concept stage. It's more difficult to develop human gastroid models. This one is the TerraTox test, which is relatively new. It's non-commercially available, and this assay is based on the 3D culture of iPSC cells and their differentiation into different germ layers. So it aims to provide a human relevant system for identifying potential direct acting embryotoxic. But it's a new method, so it's not yet validated again. And the expression of genes and different pathways involved in the embryo development can be highly dependent on the different culture conditions. So it's pretty difficult. And shifting to the whole organism eco model, I'm pretty sure that you know the C. elegans worm and with the C. elegans ReproTox assay, which is designed to understand adverse effects on reproductive capacity, including fertilization, embryotoxicity, and teratogenicity. While it's non-human, C. elegans can predict human development activity for direct acting chemicals. However, it's not formally validated, and there are some limitations, like the species difference in metabolism and the need for standardized reporting guidelines to interpret the data. The FETAX, which is the frog embryo teratogenesis assay on Xenopus, is another whole organism model that assesses embryotox in frog embryos. So it can measure different endpoints like the embryo mortality, malformations, growth retardation, and also provide additional insights into heart rate, and biochemical markers. It was evaluated by IGVAM, but it's not yet fully validated or optimized for a regulatory application. One of the reasons is also the sensitivity to the variation in water quality and temperature that also requires careful control to avoid false positive results. And finally, the last one is the zebrafish embryo, which are a widely used whole organism model for DevTox. So they allow for the assessment of lethality and also morphological and functional endpoints. And these assays are kind of good when we look at the validation status and are capable of predicting human embryo tox for direct acting compounds. So, despite significant progress, as seen just now by the number of different NAMs, challenge and gaps remain in enriching our evaluation strategies for the teratogenic predictivity. We have a lot of questions now, starting with hypothesis generation and the current knowledge and scientific gaps that we have regarding the mechanism of action. The first question would be how to identify a teratogen from a non-teratogen using NAMs. Are we confident enough in DART biological coverage? Can we build an AOP? We'll see that just after on teratogenicity. What are the possibilities, existing tools and approaches? Can we build a robust toolbox addressing endpoints and cellular processes and signaling pathway to understand teratogenicity? And finally, this is going to be the objective of everybody working on DevTox NAMs. How can we build a defined approach using a relevant toolbox for a risk assessment strategy based on what we know? So to address these challenges, we have worked on a global methodology for evaluating DART potential. So this integrated approach involves three things. First one is the understanding of the biology of human embryonic development. Then is also to identify the key cellular and molecular events. And finally, to leverage the state of the art in DART NAMs development. this is what we tried to do, and we have published this paper 1 month ago. So one critical component of this methodology is the identification of biomarkers based on AOPs, adverse outcome pathways. They can provide, and I'm pretty sure you know AOPs, but they can provide a structured framework linking molecular initiating event through a series of key events to an adverse outcome. And here you can see two different examples of AOPs. The first one is about maternal effects and the link between estrogen receptor agonism that can lead to a decrease in population growth rate or, again, alteration of reproductive behavior. The other one is just another example, is about late organogenesis with the implication of the VEGFR receptor, which is known as the receptor that causes the disruption of vasculogenesis and angiogenesis. So the identification of biomarkers from key AOPs can be categorized, you can see, in different blocks. What we did is mapping the literature and the AOP wiki database to identify biomarkers related to fundamental teratogenicity mechanism, such as the one you can see here: folate antagonism, neural crest cell disruption, endocrine disruption, oxidative stress, vascular disruption, and to finish, specific enzyme and receptor pathways. So these blocks represent the primary pathway through which toxic agents can induce developmental and also reproductive effect. Building on these AOPs, we can also identify what we call, and I'm sure you know them, the key characteristics of DART. Key characteristics, so they are fundamental biological alteration that serve as the basis for understanding reprotoxicity. So drawing from the literature and these two papers here from PubMed, we've identified first male and female key characteristics, and then we try to merge them to what I call common key characteristics across both sexes. These include, when you do the merging between the female and the male key characteristics, hormonal alteration, genotoxicity, epigenetic alterations, oxidative stress, but also cell survival, proliferation, and altered immune function. So it's pretty interesting to see that how can we use these cases? I mean, they can serve as general traits indicating a potential hazard regardless of the specific temporal sequence. And this approach is pretty nice, can provide a powerful way to categorize and also to understand a bit more the DART mechanisms. So then what we did is merging these 6 AOP blocks and the 6 common key characteristics to create a more integrated understanding of the DART process and its relevant biomarkers. And this is where we end up with these biomarkers, okay? As you can see, we've got like 9 different biomarkers. The question is now, what is the complementarity between key event from AOPs and key characteristics? So if you look at key characteristic, it's more like a general traits to tell you about the potential hazard, and it's got no specific temporal sequence. Key events, they've got specific biological changes and in a sequence leading to toxicity, and it's all the key events are arranged in a chronological order. So if you want to say that, key characteristics can describe what makes a chemical toxic, the why, and key event can describe the biological steps of how that toxicity appears, the how. This is where the two elements can be complementary in a mechanistic approach. So then we try to, I mean, it was pretty easy because we know very well the human embryonic development stages, which is fundamental. So on this slide, we try to illustrate the progression of this embryonic development, which started from gastrulation, where germ layers form, through then neurulation and organogenesis, and finally to fetal development. So this highlights the critical windows, in fact, of DART. So the question we have now knowing this biology of human embryonic development, what kind of mechanistic information can we obtain from that and from all the in vivo studies that we have? And this is where we emphasize that each developmental stage presents specific AOPs and key biomarkers for that evaluation. So as you can see here, we've got an identification of all the different stage-specific mechanistics, and for all of these different stages, we have at least one AOP. So we try to map some AOPs to the different stages to understand the window of vulnerability and where we can better pinpoint when and how a potential substance effect might occur. Unfortunately, we don't have, I would say, a lot of different AOPs on ReproTox, so we only work with what we know now. And this matrix so illustrates how various NAMs can cover the 6 fundamental AOP blocks related to DARTs across molecular, cellular, and organism level. As you can see here, for example, the NAMs are divided into those which specifically measure one or more of the biomarker listed, and those which indirectly cover a mechanism due to the test system processing the pathway, but which are not specifically measured in the assay. It's called NAM indirectly measuring biomarkers. So you can see, for example, that transcriptomics, pharmacologic profiling can directly measure some kind of AOP blocks here. And we also have some other NAMs, for example, the nematode C. elegans or the fish embryo test. They can map all the different blocks here, but indirectly measuring biomarker. So it's pretty interesting to see that there is a strong development of assays and for receptors, for enzymes, and DART-linked biomarker, approximately 11 assays, with good selection for endocrine disruption, where we have 7 assays. And then what we wanted to do, it's expanding on the previous slide, and this matrix shows how DEFTOX NAMs can cover different DART stages from maternal fertility now to fetal development. And importantly, NAMs cover all stages of fertility and embryonic fetal development, providing, I would say, assessment tools for each critical stage. Whole organism assay and 3D models like gastroloids offer a broad coverage of DART mechanism, even if they don't directly measure the specific biomarker. So combining all these different approaches can ensure more comprehensive and relevant biological coverage of DART mechanisms. So it's very interesting to see how we try to map these different NAMs to the morphological event of embryonic development. I will skip this one. So I'm going to. I still have like 5 minutes more.
Okay, you have 5 minutes left. 6 minutes.
Okay, great. So now the question would be, what would be the optimal DART-defined approach? When we say optimal defined approach, it's like most protective of human health. So it must consider critical windows of exposure, dose and duration, but also the multiple mechanistic targets, and for sure the human relevance. So it must our strategy, I would say, can focus on understanding the biology of embryonic development with the different key characteristics and AOPs. Also to address the gaps in mechanistic and developmental stage coverage. And for that, I would say we advocate for integrating advanced human relevant models. Okay, this is very important. We want to predict the human, not the animal anymore, and implementing a tiered assessment strategy. So it's kind of a collaborative call for action that aims to integrate KISSes with NAMs, in silico tools, and also artificial intelligence to develop more efficient, reliable, and predictive tools. And just to finish, this is a very small example of an application. So we have developed at L'Oréal an integrated testing strategy 2 years ago using different substances, 85 reference substances. And within these 85 substances, 49 were negative and 36 were positive. And we use 3 different names. The first one was an in silico tool, the DART in silico from the OCD toolbox. The second one was the zebrafish embryos, and then the DevTox assay from Stamina. So one in silico tool, one whole organism NAM, and one stem cell assay. And what we did is to look at how can we combine all these tests together. And it was pretty interesting because we started with the OECD QSAR toolbox, which is the first filter, with a very nice sensitivity and specificity. And then the fish embryo test were used as a second filter, so using a whole organism with, again, a very nice sensitivity and specificity, and with all different DART processes, but indirectly covered in the whole organism. And the first one we had is the DevTox assay based on human cell with a nice sensitivity, but a specificity a bit lower that we can improve when we add a comparison with the Cmax. And at the end, when we mixed all these 3 different NAMs, we had a performance, what we call a 2 out of 3. Okay, we have a global sensitivity of 96%, a specificity of 71.4%. But the question is, this is the good one. I mean, this is the first step in developing a YATA. It's combining 3 different NAMs, but how many NAMs do we want to add to be sure that we can cover everything? Do we need to add other tests like the repro tracker, like gastrolytes? And this is an open question because if we want to add different NAMs, we won't end up having, we cannot add like 10 different NAMs. It's going to be like too much. So this is going to be the question: what do we want to predict, and are we sure that these NAMs cover all the biological development that we know yet? 3 slides to finish about the building confidence in the user NAM. So you know that regulatory acceptance is key to integrate NAMs into safety assessments. And this slide shows you that some guidelines from bodies like the European Medicine Agencies and the SCCS are increasingly acknowledging the value of alternative test system for preliminary investigations and mechanistic studies. For example, you got the ICH S5 guideline when you can see that they recommend to use other test systems than whole animals. The one for cosmetic, the SCCS, you've got a very nice section on reproductive tox where they say that some of the NAMs have been validated. However, they cannot be used for quantitative risk assessment, and the complex endpoint of reproduction tox is not covered by the above system. And the last one is from the OECD, where I put it in yellow here, either in vitro or in vivo assay that might precede a long-term study of reproductive effects. So they're saying that you can use some in vitro tools. Despite their acceptance in guideline like the ACH S5, DevTox NAMs still have limited regulatory use in pharma, and this is a recent paper published within the DART-HASI consortium, where you can see that industry primarily leverages these NAMs for early screenings and mechanistic studies, which is a crucial first steps. So this is from the HASI DART Technical Committee, which is a very nice committee working towards this goal and aiming to build confidence and streamline the acceptance process. So this paper was published a few weeks ago. And within this committee, the approach is also evolving, moving from a hypothesis-driven approach studies to a more structured process for pharmaceuticals and chemicals. And these are publications that are ongoing within the committee to try to demonstrate the utility and the reliability of these new methods. And to finish, while it's true that fundamental non-specific mechanisms like hormonal changes and oxidative stress are well represented by NAMs, but not really specific. Gaps remain, particularly for, I would say, a direct listing of some specific mechanisms like folate antagonisms and vascular disruption in the KC list. So looking forward, I would say that our future steps involving achieving a good understanding of mechanisms and key events leading to specific outcomes, and also including spatial, temporal, and morphological context of the developing embryo, as well as the applying an integrated testing strategy for what we call next generation risk assessment. What I would say also to finish is collaboration is key. And I really think that data sharing is key when we want to develop YATA, because we're going to need a lot of information, a lot of different compounds. And for me, always about sharing. And this is where we work a lot with different consortium like the ICCAs, like HESI, and I would like to thank them also for their contribution to all of this. So thank you all. Thank you to my colleagues and collaborators who contributed to this work. This include our worldwide safety evaluation team, PBPK stocks, Biostat in Silicon, EUROTOX team, also the consulting partners, and special thanks to Stamina, Biobean, and Toxis, and the support from HESI and ICCS for this. And all this presentation was published 3 weeks ago, so if you want to have a look. Thank you very much to all of you.
Thank you very much, Matthew, for this very comprehensive presentation. You can put back your camera if you want, so we can see you. So I have some questions. I will start with a question from Bastian. What NAMs, it was a question that was at the beginning of the presentation, maybe you partially answered it, but question, what NAMs can be combined to obtain the best prediction given the current methods available? Which methods are the most promising? If you can make a not too long answer.
No. I would say there is a new NAM for me, the gastroloids. Gastroloids are pretty new, and they are really mimicking the embryo at the beginning of the development. So for me, these NAMs are very promising. But we've got an issue with these NAMs. First, it's new, so every time it's new, it's difficult. We have to work a little bit more on them. And we are really in the process of starting to have like mouse gastroloid, because it's pretty easy to create mouse gastroloids, but it's pretty difficult to have human gastroloids. Okay, and this is one of the promising, I would say, NAMs that we can use. Stamina, DevTalk Stamina that relies on metabolomics, and also ReproTracker are very famous and are the two stem cells based NAMs that are, I would say, starting to be validated by some agency. For example, I know that Stamina is in the FDA qualification process for validation. So these NAM using stem cells are also very promising. So the answer would be a human-based NAM is the good choice to start developing the complementarity between all the different NAMs.
Okay, thank you.
Just maybe to answer a little bit more, what we did at L'Oréal is combining one whole organism with one human cell and one QSAR in silico models to have the complementarity between cells, whole organisms, but animal versus human also. So I think it's good to have this kind of complementarity. Yeah.
Because there was also another question from Julia that it was online, which was you just said. He said, my question is, at L'Oréal, have you already applied the YATA or the available NAMs for DART in a regulatory context? And if so, what was the feedback from the regulators?
I wish we could.
So did you already use it?
No. We didn't apply the YATA for regulatory context. For now, it's more like a research basis, okay, and it's for mechanistics and prioritization, okay. No, it's something we want to do, but to be really honest, we're working on a first version of this YATA. So it's the version 1, and we're trying also to understand how chemicals like cosmetics act with the NAMs, because it's pretty different. When you've got a cosmetic compound, it's very different from a pharmacological compound. So it's all about the applicability domain and understand how do this compound can react with the test. So no, for now it's just like mechanistic and a straining. Yeah, but it's something we really want to do when we'll have other version of this YADA.
Okay, there were also a very specific question. Can you specify the Leydig cell assay, please?
The Leydig cell assay is an assay used for testicular toxicity. What kind of specification do you want on this test?
It was not specified in a question, so we cannot have the people speaking because it's too confused after the. So maybe it is a question from Yoni. Yoni, maybe if you want to add some specificity in the chat, and I will then go on with it. And I will follow on a question. There are questions from Marie-Christine. I mean, a question about enough specific about the false positive and false negative data. What do you think about false positive and false negative data with these NAMs to date?
We're trying to understand why we have false positive and false negative data. And this is where applicability domain of the test is very interesting to understand false negative and false positive. This is where we want to add, different NAMs. When we created the YATA, LoRa's YATA, the idea was to have two adder-free approach. So if two tests are giving the same conclusion, then you would say it's potential positive or potentially negative. So yeah, I would say I don't really have the answer. How do we deal with false negative and false positive results? What we're doing is trying to understand why do we have false negative results. And for example, for the compounds that give you a false negative results, the idea is to see what are the I would say the similar characteristic of these compounds. Sometimes you can see that you've got a false negative because the pK is very different, or other chemical interaction with this chemical. It's all about the chemical space of different compounds. So how can we link a false negative result to a specific chemical space of a compound? This is what we are doing now to understand false negative and false positive result. But it's research. So we're trying to understand what's behind this.
Another question from Noel. You said that AOPs are work in progress. So what would we need now to consider the AOPs you showed as complete? So
good
what are
one.
the next steps?
If there is a validation of the AOP in the AOP wiki database, do we consider that this AOP is complete or not? So this is another question that we can have of that. For now, we have all the different AOPs from the literature, but from the database also. And when I say all the different AOPs, it's not that much for DART DevTalks. It's like maybe 20, 30 AOPs related to these different endpoints. So the question is now, what can we do with these different AOPs? And something we really want to work on, and this is where I'm asking for help, as anyone knows AOP network very well, is to build this AOP network within all the different AOP, okay? Not a single AOP would be useful, but a network of different AOPs could be very useful to understand all the biological process behind the embryonic development.
Because what I saw when you're describing your AOPs, there's a lot of different molecular initiating events, which is quite normal, okay, because it's a very complex phenomenon. So you have different molecular initiating events. But right now, what is the kind of effort you're putting in to harmonize these AOPs? Because you see the AOP system, you put AOP in the wiki, and after the guide, you put in AOP in the wiki, etc., etc., etc. And after you end up with many, many AOPs, and sometimes they're very redundant. So there is an effort to try to harmonize these different molecular initiating events and the different AOPs corresponding to the molecular initiating event. Because after there is some if you look at teratogenicity at the end, there's some steps that are common. So,
I would say that artificial intelligence could help on this one, trying to merge all the different molecular initiating events because it's true you got a lot of different molecular initiating events, and you got even more some key events. Okay, so the idea would be to map and to try to pool all the different molecular initiating events, and that could be the trigger for DART, but a initiating event could be hepatotoxicity, for cardiac tox. So this is the specific
we have issue with your Wi-Fi. We cannot hear you very well, Matthew, right now. Matthew?
Can you hear me?
Yes.
All right, can you hear me now?
Yes, we can hear you. It was interrupted for 10 seconds. So if you can repeat the answer, that would be nice.
I don't remember what was the point. It was like a molecular initiating event. Yeah. So a molecular initiating event can trigger different toxicities. A same molecular initiating event can drive to a DART effect, but also, for example, a hepatotoxic effect or cardiac effect. So this is a challenge because we really need to understand and to map what kind of molecular initiating event can be pooled and specific to address a DART toxicity. But this is also very challenging, and this is where I said artificial intelligence can help. I'm pretty sure.
Okay. So next question. So how relevant for human teratogenic effects are some of these NAMs that rely on other species like the zebrafish, although covering specific relevant DART stages in the framework? So the idea is how is it relevant? How these NAMs relying on zebrafish and other species are really relevant, and how it's covering specific relevant DART stages in the framework. So it's come from
zebrafish. For zebrafish embryo, we share approximately 75% of genetic homology with this embryo. So I think it's pretty good. When you look at the emoji we have with in vivo studies, I would ask also the question: how can we rely on a mouse, a rabbit, and a dog, for example, if we want to do the comparison? So I would say it's the same thing. We all know that there are some kind of species differences, and we know that we should and we have to take them into account when we do safety assessments. So yeah, we just have to know that there are some differences, and it's going to be the same thing with cells. Using in vitro cells, you also know that there are some differences. So this is something we're taking into account in the framework. And when we do a risk assessment using NAMs, there's also at the end of the safety assessment part where you try to explain all the different BAs and all the different difference that you have in the interpretation. So we take into account every time this kind of information.
After it's a question of validation and how many molecules you are testing in your system. I agree. So there are so Yoni is precising his question. So I wanted to know whether the Leydig cell assays refer to experimental protocols or commercial assays. And the second question was how to separate so if you can just answer the first part of the question. Is it experimental protocol or commercial assays?
I think that the Leydig cell assay is not longer available. It was a commercial assay that was available for testicular toxicity, but it's not available. No, there's nothing on that. And the second question, how to separate embryo toxicity from teratogenicity in vitro? This is a good one. I think it's pretty difficult to do it because teratogenicity is a kind of also embryo toxicity. It's kind of the same thing. because you can have a teratogenic effect on embryos. So I don't think the idea would be to separate them, but to assess them as they were the same thing. Okay.
But in some of the organisms, like for example, in zebrafish, you can see the malformation sometimes, which
Yeah, this is
not always leading to the death of the embryo. So
no, and
it's
it
difficult.
depends if you can see the adverse outcome also. This is the if you can see the adverse outcome on the zebrafish embryo, this is a teratogenic effect, okay? And
Mm.
you can see, for example, for the embryo toxicity, but we were using the embryo for 5 days because it's not considered as an animal for 5 days, you know. So when you see something under embryo, okay, there's an embryo toxicity, but what would be the outcome when you have the adults after that? You know, that we don't know.
Okay. So the last question, c'est short answer, please, because how challenging are gastroloids to work with in terms of cultures and also in quantification? Are they amenable to high throughput screening?
Yeah. Males gastroids are pretty easy to use. Human gastroids are pretty difficult. It's very challenging in terms of quantification and in terms of culture. I think it's very difficult. I'm not an expert in gastroids, but I know that it's very difficult to have like very relevant human gastroids. And I hope that they will be useful for high throughput screening. And please, if you were working in the human gastroid field, send me an email. I really want to discuss with you. It's something we really want to develop now.
Okay, so thank you very much, Matthew, for this very comprehensive presentation. Very complete. You had a lot of questions, and I'm sure the people were very interested by the presentation. You have very nice comments. Please, you can see on the screen that the next webinars. The next one is on November 27th with Georgia Del Favero on cell deformation and chemical carcinogenesis, and after we have Helen Hessel for testing strategy for developing neurotoxicity, which is following your presentation, based on the mechanistic knowledge and developing brain. And Helen is very knowledgeable in this field, and also Georgia De Favoro in the chemical carcinogenesis. So I hope you will attend. You will receive an email as usual. I mean, not an email. It will be advertised using the classical channel in EUROTOX, and please apply to the webinar. So thank you. It was well attended. We were more than 70 people attending the webinar. So it's a nice number. So thank you again, Matthew, and thank you to everybody. And have a very nice day. Thank you very much. Bye bye.
Thank you all. Bye bye.
Thank you, Matthew.